Hello, my name is Sidhbh Gallagher. I am a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. And in this video, I'm going to talk about the top 10 reasons patients may want to avoid drains. So what I'm talking about here is specifically patients who undergo top surgery, either female to male patients, transmasculine patients, or non-binary patients. So first of all, we've talked quite a lot about what drains are and how we're able to avoid them in other videos with our technique masculoplasty. But despite that, there's still kind of some confusion out there. So these are my top 10 reasons you may want to avoid one. Now, not all of these reasons are necessarily scientifically proven. In order to do that, you need to gather data. Some of them are, but some of them I just see by experience. So what we'll talk about, number one reason to avoid drains: less downtime. So most of the time when you get a drain in after top surgery, it stays in for about 1 week, but that can be a little bit unpredictable because what happens is that drain goes inside your body and it's suctioning out that fluid, and it really depends how much fluid your body produces. So it may be in fact more than that. It could be 2 weeks plus, and really you're not going to want to go back to work with drains hanging out of you. So for that reason, drains can lead to more downtime and time off from your surgery, and a little bit less predictable. Reason number one. Number two, particularly for folks traveling from out of town, this can be a problem. Having the drain in leads to unpredictable amount of visits to the office. Now again, hopefully that drain is going to come out at 1 week if your body cooperates, but that's not necessarily true, and you may have to come back for a second visit in addition to when you get your dressings taken down off the nipples. So an extra visit, it can be a small thing if you're staying in town, but if you're coming from out of town, that can be a real problem. We're trying to find somebody locally who can deal with your drains. Reason number three, big reason, we found with our technique for masculoplasty, the whole reason you put in a drain is to avoid a seroma. And we had zero seromas whatsoever. So doing the technique we do in masculoplasty is a better way of preventing a seroma, which is a fluid collection. So there is a better way to avoid it than drains. Number three, what goes in has to come out. So again, it can be a hassle. It's another little procedure, removal of a suture, and the drain has to come out in the office. Most patients don't find this very painful, but some patients do, and it's, again, just the hassle of removing it. The next reason I would say is just having the drain there for a lot of patients can cause anxiety. It's just not really pleasant having a foreign body, just the thoughts of a foreign body inside your body. And sometimes things can go wrong with them. They can lose suction, they can get clogged, and so that can be kind of anxiety provoking in the middle of the night. The next reason I would say is that they do cause pain. So I always notice this, and this was really my motivation to really develop that that drain-free technique, is to decrease drains or to decrease pain, because I always noticed way back from my general surgery days, when we do a major surgery in somebody and maybe put a major incision on them, and you ask the patient what hurts, it's always the drain side. So by doing the drain-free technique, we're able to decrease a patient's pain. The next issue with drains are they do fall out. There's one particular study in the orthopedic literature showing they fall out 5% of the time at 24 hours. And then that can be a problem, because the whole reason the drain is in there is to remove fluid. And once it falls out, we don't have the backup. The next reason, not necessarily very scientific again, is they're kind of gross. Patients sometimes find that they're gross because what they do is they suck out old fluid and blood and just kind of dealing with them, and emptying the drains for a patient can sometimes be kind of gross. So the next reason I would say is because we're able to use a drain-free technique, our patients are able to shower whenever they're feeling up to it. So it's a day or two after surgery. So that in and of itself goes a long way in your comfort after top surgery. And then the last reason, again, it's not common at all, but sometimes when that drain is being taken out, it's not unheard of that it can stir up problems like maybe some bleeding on the inside. So those are my top 10 reasons that you probably definitely do not want a drain placed. We have scientific data to back up the fact that there are decreased seroma rates, decreased hematoma rates. So drain-free is a safer and more modern way to do it. And we do it by masculoplasty. And we have other videos detailing exactly how we're able to do that drain-free technique.